An all-on-4 is not new. All-on-4 actually, a lot of people nickname a prosthetic called the All-on-4. The prosthetic is not an All-on-4. The prosthetic is what we call a hybrid overdenture. It's been around for 25 years. It's nothing new. It's evolved in the way it's done. The old hybrid used to be made out of a denture material. And over time, we have changed the materials to have zirconia and titanium zirconia ones built. And they can get really high-end and creative with ceramics and really, really beautiful. So there's many types of materials. The All-on-4 is actually a technique of how we place the implants themselves, which are the screws. It's not the prosthetic. But the information out there is very low, so people nickname the hybrid as an All-on-4. The All-on-4, what you look for and make sure is the All-on-4 back in the day is we would place the implants and then we would take a denture and at the time of surgery, hand place the denture and lock them into the implants. Now what you look for, if you're going to consider that procedure, is the digital workflow called photogrammetry, where we actually have the day you come in for the surgery of the All-on-4 or 4 implants, let's say, they're able to give you a prosthetic that same day in your mouth. And instead of doing something by hand, we do it all with 3D printing with a laboratory, and we're able to seat this beautiful piece right in your mouth that's made out of resin. And we hold you in that prosthetic for about 10 weeks, and then we make you your final prosthetic of like a titanium or zirconia. So what you look for is what type of hybrid are you giving me? What is your training? Training on hybrids is prosthodontics. So you always want to ask your doctor, where did you learn to do the hybrid prosthetic, which is termed the All-on-4. Back in the day where that name came out, the All-on-4, it was because this hybrid was meant for people with the worst bone loss ever. And as a surgeon, we could only get 4 implants in most of those patients. What you'll find is a lot of 8% of the All-on-4s or the hybrids that are done today, you can place 4 to 6, even 7 implants per arch, which I would recommend. So if you're a hybrid patient looking for that solution, and if you have enough bone to do 6 implants, make sure the doctor puts 4 in the front, 2 in the back, so your prosthetic is fully supported. I believe anybody who's a good candidate for this is somebody that's losing all their teeth. When you're losing all your teeth, usually a patient has 2 options. You have a removable prosthetic option and you have a fixed prosthetic option. And so the candidates that I'm losing my teeth are shot, I need solutions. Just remember, if you're your candidate losing your teeth, you have 3 options. You have 1 removable option, all right, with implants, and you have 2 fixed options. When it comes to fixed, meaning it doesn't come out of your mouth. You have your removable, you will have your overdenture, the nickname is snap-on, or your fixed options would be your hybrid, which is a little thicker, it's like a bridge, but it's not a bridge, and it stays in your mouth, or you can actually do a traditional bridge. Called an FP1. A bridge actually has its own natural gums, so it comes out of your gums just like your normal teeth. Hybrid, typically an easy way to say it is you have fake gums, because those are designed for patients that have lost a lot of bone. Hybrids is a better choice than traditional dentures or even the snap-on dentures because the implants are cross-stabilized. So back in the day when we were doing 4 implants and doing a snap-on denture, we started noticing that patients with bad bone, we would make them a bar to put the denture on. And then we started noticing that those patients would not lose implants when we had a bar on it. It's called cross-stabilization. So if you're a denture patient looking at this and you have those little gold buttons and it's a snap-on dentures have about 50% function. Fixed option like a hybrid has about 95% function. The other difference is the fact that the hybrids today are non-porous. All right, so they're very, very made out of crown material. Snap-on denture is a very porous material, so it requires hydration. So if you're a patient with dry mouth, anything like that, and you struggle with the snap-on, it's because it needs water. That's why you have to soak those things. So the benefit in a fixed prosthetic is you have an increase in function. You have a less chance of losing an implant if it's done right because it's cross-stabilized. And from a cost perspective, it typically costs less. So there's a difference between price and cost. The Snap-on may be a cheaper price at this point, but what we find as clinicians is people tend to lose implants over time with that prosthetic.